And we'll be announcing something very soon on pharmaceuticals, tariffed at a very, very high rate, like 200%.
What you're seeing here is potential for a very serious attack on our healthcare system. Under the Pharmaceutical Benefits Scheme, PBS, government subsidises the cost of most of our medications. It means that we pay much less for medicines than Americans. In fact, in 2024, US drug prices were on average about 370% more than ours, almost 4 times as much, and 3 times above the OECD average, in fact. Affordable medications are at the absolute heart of our healthcare system. Donald Trump is threatening to put a 200% tariff on pharmaceutical imports to the US. Essentially, that's a really big tax on Australian medical exports. Pharmaceuticals are one of our biggest exports to the US. Last year, we sent more than $2.2 billion worth of medications across the Pacific. America's pharmaceuticals industry is furious because our PBS actually forces them to negotiate on medication prices. They're pushing Donald Trump to punish us because we have a government which has advocated effectively on the people's behalf. It is worth remembering that the US pharmaceuticals industry sent us US $3.5 billion worth of medicines last year. We've traditionally benefited, in fact, from free trade between the two countries. It's also worth knowing that the US is thinking about taking how we approve and market generics, cheaper forms of medication, because the US is also arguing that our trade practices around generics disadvantages them as well. It's a really important piece of the puzzle. Changing Australia's medical system to be more like the US would delay availability of generics in our market. It would keep the price of drugs higher for longer. This isn't just a trade dispute, it's a serious challenge to our healthcare model. Australia has to stand firm. The government has to defend our PBS. It has to defend our access to generic medications, because healthcare should never be a bargaining chip. It should be a right.